HBCUs were created to educate Black students who were not allowed to pursue tertiary education at white colleges in America. Since their inception, HBCUs have provided a safe space where young Black people can learn and flourish without the constraints of racism. In a world that too often offers only the stereotypical narrative, here we celebrate the impact that HBCU grads have made and are making on our world. Welcome to the greatness. Today on the HBCU Footprint, we highlight not a person but an entity. We celebrate the Morehouse School of Medicine and its strides in closing the health disparity gap. The Morehouse School of Medicine was founded in 1975 and has been one of the primary producers of Black physicians in the U.S. The other main producers of Black doctors are Ivory Medical College, Howard University College of Medicine, and the Charles Drew University of Medicine and Science. Even with the work of these institutions, studies have shown that Black people, who make up 13% of the U.S. population, only make up 5% of U.S. physicians. And of the 21,863 people entering medical school in 2019, only 1,626 were Black and only 619 were Black males. In an effort to address these dismal numbers, Morehouse School of Medicine and Common Spirit Health formed a 10-year, $100 million partnership to get more Black doctors into the community. Headed by CEO Mr. Lloyd Dean, Common Spirit Health is one of the largest health systems in the U.S., operating 137 hospitals and 100 care sites across 21 states. The president of Morehouse School of Medicine, Dr. Valerie Montgomery Rice, noted that the partnership was monumental and needed to help in reducing health disparities in vulnerable communities. The unfortunate and visible disparity may be seen in the case of Dr. Susan Moore, a physician who took to social media as a patient to point out disparities in her treatment by a white physician as she battled COVID-19. She unfortunately eventually did die, but not before shining the spotlight on differences when care is provided by a white physician attending to Black patients. Many studies have shown that Black patients taken care of by Black physicians usually have better outcomes, as there is more awareness of cultural differences on the part of the physician and a greater level of trust on the part of the patient. So, for its partnership with the Common Spirit Health Group, aimed at tackling healthcare inequality for Black patients, and for its dedication in producing top quality physicians of color for the community, we celebrate the ever-widening HBCU footprint of Morehouse School of Medicine.